So welcome everybody. I can't wave to you. We've got a lot going on. We are at the Joshua Tree Yoga Festival. It's a beautiful weekend. I can't even tell you, my experience so far is so incredible. And I get to be here with these incredible humans sharing some of my knowledge. And the title of my talk is actually Mula Bandha, Harnessing Your Pelvic Power for Yoga, Sexual Vitality, and Longevity. You look familiar.
Yes, I have met you on a goat hike.
Oh, we were on the goat hike together. Awesome. That was another fun time in Joshua Tree as well. We need the male pelvis back here, Rick. Come on.
I need support.
That's right. So,
I'm with you, Rick.
So my name is Dr. Trish. Can you hear me?
Yes.
And I am a urogynecologist. That means that I have completed a medical degree in OBGYN and then 3 extra years in a fellowship in pelvic medicine and reconstructive surgery for women. And so I don't do pap smears or babies. I only take care of the pelvic health of women when things go wrong traditionally. But now, as I have had many years in that field, my whole focus is on how to prevent, how to maintain, how to improve. And my other background, even before I ever became a physician, is I was a fitness instructor and for about 35 years. And I have taught yoga for 8 years. So I have all these fun backgrounds to bring together to help take care of my patients and improve women's lives and now really their partners' lives as well. So we're going to talk today about why the pelvic floor matters. And I do have notes because I have so many things to share with you. And it's a little new talk for me. And even though I actually do speak all over the country in front of lots of people, hundreds of people, this makes me nervous because some of you have more knowledge than I do in areas. And so we're just going to make this really easygoing, and I'm going to share as best I can with you. So, the pelvic floor, we all think we know what it is. And in reality, even in just my medical space, every day if I examine a woman and I check her pelvic floor, which most of us, I haven't even defined what that is yet, think we can do a Kegel, right? We're all checking it right now. We can squeeze. But I will tell you that 7 to 8 out of 10 women cannot do a proper pelvic floor contraction. Because women and men, because men and women have the same exact pelvic floors, right? Which I'll show you here. This is a female version. We're not really connected in that area. And as yogis, we have a little better understanding of the pelvic floor, but I think you'll walk away understanding even more about it because even just a minute ago I was in a workshop and we were doing the wrong breath to engage the pelvic floor. So it's really interesting that we think we know what the pelvic floor is and how to activate or how to engage it, but most of us actually probably don't. The pelvic floor is responsible for so much. In fact, I really think it's sort of the cradle of the entire body. It connects your spine to your legs, right? This is the pelvic floor, spine. This is the pelvic floor from the back. This is the pelvic floor from the inside. And this is a female external pelvic floor. But the only difference really in men and women is that this muscle that wraps around the opening in women is split, and in men it's fused, right, at the base of the penis. Everything else is the same. So the amazing thing is we're all going to learn something about that. But when you think about these muscles, this group of muscles, which is so many, the pubococcygeus, the iliococcygeus, the puborectalis, which slings around the rectum, the coccygeus, which connects the coccyx, right, to the pelvic floor. Look at this basket and what it does. It literally helps you stay upright, right? So this is your abdomen, this is your spine, these are your hips, this is your pubic bone, this is your pelvic floor. It holds us together. It keeps us stable. And if your pelvic floor is off or your spine is off, your pelvic floor is off. Everything is connected. So whenever I see patients who have a back issue and their orthopedist is like, you're not leaking urine because of your back issue. I'm like, your back, your neck is connected all the way down to your root. It's all connected. We are connected from head to toe, muscularly, nervous system wise, and then also energetically, right? So the pelvic floor is responsible for stability. It's responsible for our continence. That means being able to keep the pee and the poop in, right? And also our sexual function. And that means, yes, the sensations as well as our ability to not have pain and our ability to have pleasure, as well as our posture. If your pelvic floor is off, your posture is off. And also our nervous system regulation. Because down here, your pelvic plexus is where we actually get the sensory input, and then we get the external input of, or the sensory, my brain is totally blanking, sensory input, and then when we put out input to activate muscles and also be able to feel. So what's my perspective? Again, I told you I was a urogynecologist, I'm a yoga instructor, fitness, I'm also a mother. I've had 3 babies vaginally, even though my field says everybody should have a C-section because when you have a vaginal birth, it's going to blow out the pelvic floor. And there is a lot of data that says, of course, vaginal birth damages the pelvic floor. Most of us are built to rebound from that and to heal from that. And so not everybody needs to have a C-section. However, we are having babies later, and therefore our tissues are not as resilient. We have less collagen, less elastin. We have weaker muscles also. And so we don't recover often as well if we do have our babies a little later. And my last child was born at 39. So again, some things to keep in mind if you take care of women in any of those age ranges, either if they're having children, they're having pain with intimacy, and we'll get into that. So I've done hundreds of deliveries. I don't do deliver babies anymore. And thousands of pelvic floor reconstruction. And so we said, well, what the heck is pelvic floor reconstruction? Am I actually reconstructing the muscles? I'm not. When we do pelvic floor reconstruction, in fact, when I tell people I'm a pelvic doctor, they think I'm doing bone surgery. But pelvic surgery is actually just reconstructing the tube that is the vagina. There are no muscles in that tube. The muscles sit around that, right? So we're all squishing down right now. Men have pelvic floors too. But for us, the vagina is just a little potential space. It's just a smashed little tube. And there has potential to have space in it, right? If something inserts in or something comes out of there. So the pelvic floor is just the soft tissue of the vagina. And it can turn inside out. And most people don't know that. And that's what I do. I repair when things turn inside out or fall down. So that is what a urogynecologist does. And that's just the surgical component. But so many other things impact the pelvic floor. Again, I already talked about back pain, malalignment of the spine. When women have pain with intimacy, that's a pelvic floor issue, both the tissue as well as the muscles. And so as we get into what happens with the muscles, whether they're weak or they're tight, we'll get into that a little bit more. The other thing about the pelvic floor, and when I refer to the pelvic floor, I'm just talking about this. So you'll have this indelible image of this basket, the cradle of civilization right here, right? This is what I'm talking about with the pelvic floor. All of these muscles that really just support us to be upright and to be able to walk and balance and be continent and have great sexual function. So that's what the pelvic floor is. But it does relate to also the root chakra, right? And that is the chakra of foundation and grounding, and very close to the chakra above, the sacral chakra, which is creativity and sexual function. So they are very close together when it relates to the pelvic floor. It's interesting, until I became a yoga instructor and I had done thousands of pelvic floor reconstructions, I didn't think, I'm so glad you're here, I didn't really understand the pelvic floor from a function standpoint. I knew how to put things back together. But when I started yoga and realized I couldn't balance on one leg very well, and I was trying to grip my foot to the ground, I realized if I elevated my pelvic floor and really connected with that part of my body, my balance got so much better on one leg, right? Of course you need your knees and you need your feet stable and all the things, but when I have patients strengthen their pelvic floors and they are yoga students or teachers, they become so much better at their practice as well as about educating and aligning their students. And so I am always learning as I get better at cueing and better at assessing patients that there's so much more to it than just muscle, than just soft tissue reconstruction, right? And so it really changed my practice, just even being a surgeon it changed my surgical practice to be a yoga instructor, and it actually changed how I taught yoga as well. So now it's interesting. There's several facts about the pelvic floor that you may not know. One, I already told you, men and women have the same pelvic floors. But the other thing is you may not know is when you're not even thinking about it, your pelvic floor is moving. So when we inhale, your pelvic floor goes up or down. It goes down, right? So a minute ago we were inhaling and then we were like, pull up your pelvic floor, which is not really how you're supposed to engage your pelvic floor. When we inhale, we learn in yoga breath, right, that we're supposed to inhale and expand our ribs. And the pelvic floor goes down. The diaphragm, right, up here, it goes up. When we exhale, you pull the navel to the spine, your pelvic floor rises. So you're all in a great position to sit. You just put your feet flat on the ground and sit straight up and down. And it's really great if you have like a little towel to wrap up and sit on. But the first way that we teach women how to be aware of the pelvic floor, and men too, of course we can lay down and do bridge, which we can do in a minute, is that you're just flat and you're just going to put your hands here. You're just going to inhale. Expand the belly, expand the belly. You're not really going to push out of the pelvic floor, but if you want to exaggerate it a little bit just to sort of feel it contact the chair. And then exhale. Pull the belly button really to the spine. And you just feel sort of a natural elevation of the pelvic floor. And if you don't feel that, you just have to practice it a couple times. Some of our physical therapists, they'll roll up a little towel and just sit it between the legs, just like a little roller to sit on it so you can kind of feel that up and down. So we're going to inhale again, puffing out, hold it, and then exhale. And you can even do a little conscious squeeze, basically what you think you're going to do when you cut off the flow of urine. And so just a little tidbit there, it's not good to do Kegels or pelvic contractions while you're peeing, because you're actually interrupting the nervous signal to void, and you want to be relaxed when you void. You want to let out, let it go. Open up the lotus. Open up, I think about opening up one of those cargo planes, just like open it up. And when you're done, then you can sort of close. If you want to just check and make sure you can do a proper contraction, you would do a couple of those squeezes just to make sure you're getting the right muscles. But technically, don't do a bunch of those while you're peeing, because it's not really good for you, and you confuse your body, because your body wants to be relaxed when you void, not sort of contracting, right? So every breath we take is a pelvic floor exercise, and you don't even know about it. So if you're conscious about it, you actually can engage your pelvic floor a little better. Another fact is that the pelvic floor can sometimes be too tight. So just like we get sore muscles and trigger points in our muscles, the pelvic floor can be too tight. And again, those are the muscles. So it makes sense if we have a back problem or we have a hip problem or a knee problem, it's going to throw off the alignment in the whole body, including the pelvic floor. And your pelvic floor wants to auto-correct you and keep you upright. And so what happens is you get tightness in these muscles. And I explain it kind of like TMJ. Have you heard of that? Because they're really short muscles. So you can't really stretch them very easily. But they can get shortened. And when they're shortened, women can have pain with intimacy. They can have pain with insertion of a tampon. They can just have aching pain, and I will hear it all the time. Something is falling out. Of course, that's the other area of expertise. I'll do an exam. Everything's normal as far as structure, but their muscles are super, super tight. How do I check that? I have to obviously insert a finger and sort of check along all these muscles. And what do I feel? One side is elevated. It's very painful to touch. And how do you treat that? You treat that with certain yoga poses like malasana and frog and bridge, and sort of to open the hips, as well as going to physical therapy where they actually do internal work, which sounds really strange, but it actually works really well. And then we'll teach them how to be more pelvic floor aware and how to relax their own muscles, sometimes with different wands, and vibration and heat are amazing for every part of your body, including down there. Now, men who get pelvic floor tension, they have symptoms of urgency frequency or pain down in the perineum. And oftentimes they'll get diagnosed with a prostatitis, an infection or inflammation of their prostate, when in reality they don't have an infection at all. but their urologist will treat them with antibiotics, and in reality, they have a pelvic floor problem, and people don't think that men have the same pelvic floor, and therefore they don't always think about that. Luckily, most of us have gotten the information out, and so men can go to physical therapy as well. And what do they do for you? All the same things, but unfortunately, the access to the pelvic floor for men is through a different opening. So we just sort of have to sometimes get over that hurdle, and there's a little bit of, massage going on there as well, if that helps. But it's amazing that we can have high tone, tension, we have weakness. So if your muscle is super tight, you have no room to get stronger, to move. So we want to relax the muscle, and then we can learn how to contract the muscle. So people who have tight pelvic floors first need to learn how to relax, and then we need to learn how to build. It's really hard to build the pelvic floor by ourselves because you can't really lift weights with your vagina, and I think most people don't want to. So there are different devices out there that I have changed my practice and my patients. It's like a magnetic chair. It absolutely educates the muscles to contract and relax about 12,000 times in 30 minutes, and it is amazing because it gets blood flow and energy into the pelvic floor in a way that we have never been able to access. So we have lots of tools to relieve tension and improve strength. All right, pelvic floor muscles, they control our sexual function, right? So again, man and woman, same pelvic floor, muscles fused or open. You can imagine if these muscles are tight, they can cause pain. You can imagine, though, that these muscles are relaxed, we might not have as much sensation or grip. And so for women, pelvic floor, as it relates to sexual function, is responsible for sensation, orgasmic function, pain, of course, if they're too tense, as well as circulation. And again, the pelvic plexus is down here. That's where the parasympathetic, rest and digest, that is responsible for sexual function and orgasm. If your muscles are too tight, you don't have blood flow, you're not going to get proper sensation through the nervous system as well. So we want to learn how to connect to our pelvic floor, and we want to be relaxed. And that goes along with the whole concept of being relaxed in our connection with ourselves for sexual arousal as well as for orgasm, and then relaxed and connected with our partners. And then we can actually have that full sexual experience. All right, so let's define the Mula Bandha, or Mula Bandha, if you will, because I was always saying but technically Mula Bandha, root lock, it's really an action, right? So a Kegel is just a contraction, and again, that's just the term that's been used because the doctor named it how to do a pelvic contraction many years ago. But Mula Bandha is pelvic contraction with breath and awareness, right? So when we did that exercise and we were breathing and then we were exhaling, we were actually performing Mula Bandha, which is connecting to our pelvic floor, our root, and then activating that chakra as well, which is that energy center. So the Mula Bandha, if you will, is described as directing prana upward and stabilizing energy as well as awakening that base chakra. And it's technically located in the perineal body, which is right here. Space between here and here. And men and women have the same perineal location and perineal body. So the anatomy of the pelvic floor, we already talked about that it supports our spine, our hips, as well as helps with our bowel and bladder function. And so these muscles are very important in allowing us to walk around, and we don't ever even think about them, but keeping us actually very continent, having good sensation, having good posture, and so on and so forth. So I always like to also, though, talk about the relationship of the pelvic floor to the core. Because most of us, if you need to shift, go ahead. Most of us think of our core as our abs, right? Although we know a little better. But do you think about your long back muscles? And then think about your pelvic floor as the base, right? And then the diaphragm is the top of the pelvic floor. So in chiropractic or physical therapy, there's an analogy called the soda can analogy, where if those things are intact, the pelvic floor and the diaphragm and the side and the back, you have a very strong, intact core. If any one of those areas is either weak or too tight, your core is malfunctioning and you're not able to actually engage all of those. So we think of then core to floor is how I talk about it, right? You want to be strong from core to floor. So if we're not really engaging the pelvic floor, you're not going to get truly a strong core. And that's sort of the message that goes along with that. We already talked about the breathing where the diaphragm rises and the pelvic floor goes down, and then we exhale, things come together. That really is something that allows us to push the air out. Now you can think about it as that soda can, or you can think about it as an accordion, or however you want to do it. But as you exhale, you're pushing the air out of your lungs, right? And you inhale, you're drawing the air. So as we do our yoga breaths and we take deeper breaths in and we have more forceful exhales out, you feel that vacuum sucking the air back in, right? And then you do a bigger exhale. So it's pretty amazing that way. So what about the Mula Bandha in asanas? Well, in general, when you now go forth and you think about your yoga practice, how do you identify your pelvic floor in your movements? So different things that activate the pelvic floor. Chair pose, of course. Well, I would say pretty much every asana has the pelvic floor that's important to it. And if you're not really aware of it, yes, there are some that focus more on that than others. But we have chair pose, warrior, those are really important. We're not even talking about lifts and things like that. Those things require you to activate the pelvic floor to have proper alignment. Also, goddess pose. Cat-cow allows us to open up, get blood flow going into the pelvic floor. Malasana helps us open up the pelvic floor. So it's a perfect thing in the morning to just get yourself next to your bed and do this. You're going to open up your hips, your pelvic floor, your lower back for your day. It's amazing. In bed, before you even get up, knee to chest, open up, happy baby. Opening up the lower back, the sacrum, and you're opening up your pelvic floor. Inner thighs, glutes are very much going to compensate for a weak pelvic floor. So if these muscles are tight all the time, also, you will not be able to engage your pelvic floor at all. Lower abs, of course, as well, which is a little bit more difficult. Go away, bee. I don't like bees. All right, so the benefits of those asanas is really hip mobility, right? But then also being able to be more connected so that you can engage your core and your practice is going to change. Some of the common problems of pelvic floor dysfunction include the things that I mentioned. So improper bowel and bladder control. Most of us don't think about those things until they happen to us or we know someone that happened to that. Almost every patient of mine, we can address those issues by starting at the foundation. The foundation, again, being the pelvic floor. So the foundation is connection, awareness, strength. Then for me, it's what can I do about tissue health? So whether we are perimenopausal or menopausal, and then our tissue starts to degrade, our collagen is, we're losing collagen, restoring that. And then again, yes, sometimes we have to do surgical correction if someone's having even further issues there. So let's talk a little bit about sexual health in women. And if you want to shift because you're dying in the heat, go for it. So healthy pelvic muscles in women support arousal, as well as lubrication, orgasm, and support the vaginal soft tissues, as I mentioned. The vaginal soft tissues being the internal ones. The external tissue, just for definition, is the vulva, right? So those are the other tissues that are on the outside. As far as sexual health in men, again, what does the pelvic floor have to do with sexual health in men? Actually, everything. Men are really not ever taught to do pelvic floor contractions, but if we can have our younger women and men be more connected to their pelvic floors, not only are they going to be stronger in their workouts with their posture, but also when they're going into having children and are being sexually connected, you just have a whole nother level of sensual experience because your pelvic floor muscles are responsible for the strength of your orgasm. Yes, there is a whole mental component to it, but if you are not having a pelvic floor contraction, you are not actually, going to be able to have an orgasm, right? So for men, when they have a stronger pelvic floor, their ejaculation, which doesn't always equate to orgasm, is going to be much stronger, right? if you are aware of your pelvic floor and you're clenching, it's going to be much harder to have release and an orgasm. So again, being connected there for men and women is very important. With men, the muscles, the bulbocavernosus muscles here, right, that wrap around there at the base of the penis, if those are weak, that will contribute to a weak erection. So having strong muscles there actually enhances erectile function in men. And that's really important. So when men go to physical therapy, they'll get a little bit of awareness and instruction on how to engage their pelvic floor. And then hopefully, if there's tension in those muscles, doing some of those hip openers will really help. So yesterday, who attended the Tantra? Wasn't that amazing? Yes. So fun. So, of course, traditionally, people who don't know about that think that Tantra is only related to sexual function. But really, it's about being aware of external energy and having that influence the internal energy. And I loved how we connected with each other, with ourselves, and we're able to sort of open up that sensory awareness. And so when we think about Tantra and the pelvic floor, it's really just, again, what are we feeling as far as an external stimulation? How do I connect that brain to pelvic floor? And then either to self, relaxation, being able to experience that sexual pleasure, or how am I able to connect that with my partner in sexual pleasure? So when we think about the pelvic floor, we want to think about external sensation, also muscle activation and relaxation. And when we're stimulating here, we're stimulating the parasympathetic system again, and that is what's responsible for how we feel, and also for orgasm. So it's really describing learning how to be present with your breath, with the sensation, and the connection of our pelvic floor, ourself, and our partner. You may have heard this truth going around, which was really based off of one person's dissection of the pelvic floor about the tip of the clitoris has like 7,000 nerve endings. And that's not exactly true, but it's been perpetuated for years. But in general, our pelvic floor and our sex organs have some of the most complex and most branching nerves in our entire body. Not so much as our hands and our skin, of course, but certainly when there's stimulation to the external tissues, that's when blood flow comes in. We get arousal, we get engorgement, which means more blood flow. Blood flow gets locked off in the clitoral area or in the male penis, and that's when that tension can build, and then we can have sometimes orgasm. And again, this is a whole nother talk, but when I talk about sexual wellness, sex is not just about intercourse, but it's about all the things leading up to that, and kissing and touching and being close and sexting and mutual masturbation and sometimes intercourse between a woman and a man. But all of that relies on the fact that we need to be self-aware, we need to be relaxed, and we need to be connected, and then have a proper breath, right? So, all right. So let's go through a little bit of that breathing exercise again. And if we, you know what, I'd kind of like to bring you up here and go through, if you wanted to do a little bit with me up here, because I wanted to do a little bit of a pelvic floor flow, and then I wanted us to engage our pelvic floors sitting on our backs in bridge. If you're interested, if not, then it doesn't matter. You don't have to come up here. But I wanted us to do a little bit of our pelvic floor awareness again. So are you willing to come up? Yeah. Okay, so let's everybody come up with me. So get a little space, because we're just going to lay down, but not too far. I mean, if you have a... So we're going to sit first. So just sit behind me. Just get on in there. We're going to do a little cat-cow. We're going to do a malasana, and then we're going to lay down. We're going to do a bridge. And then we'll just do a pelvic floor activation in the bridge, because it's a little different than when we were seated. So first things first, when you're seated on your sit bones, you can't really feel your pelvic floor on the floor, right? Because you're kind of seated posteriorly. But I always like patients to sort of, like, you know, in boat pose, you can roll forward and back, and you just sort of feel your little sit bones roll. So if you roll back and your sit bones are in front of you and you just suck your belly button to your pelvic floor, you can do a little bit of a pelvic floor activation there. Try not to go crazy with this. Just kind of be in this relaxed state with your feet flat. And I want you to inhale. It's kind of hard in that position, right? Inhale. But puff up your belly because it kind of forces you to pull the muscles in. And then as you exhale, exaggerate the belly button. And do it again. And then exaggerate the belly button. Pull it in, pull it in. Can you feel a little bit of an activation there in that root, that perineal area? Okay. So from here, gently come into your cat-cow. And well, we've done a million cat-cows today, by the way. I love it. But first thing I like to do is sort of wiggle out my hips because that feels so good. Sorry about your knees, everybody. Okay, so in this, put your feet flat. I think I want you to have your toes flat. Inhale, chin comes up. As you inhale, your belly's dropping. You're lengthening. The pelvic floor is going towards the back wall. Sticking your booty up in the air and lifting the tailbone. And as you exhale, that you can really tuck the pelvic floor, and you can use a little bit of your glute muscles to begin, but in general, you don't want to use your glute muscles when you're doing a pelvic contraction. Inhale, exaggerate a little bit of that C curve, and then exhale, and really tuck the pelvis, different than maybe you're thinking about. I want you to feel that as you activate the pelvic floor. And then let's do one more. And then exhale. So these are different ways you can sort of be aware of that pelvic floor and say, okay, now I'm feeling that. All right, now I want you to go ahead and get yourself down into your malasana. And then, gently just tuck that tailbone down. Try to push the elbows out and first open up your sacrum. So just focus on feeling this part of your lower back like really open up. Oh, it feels so good, doesn't it? And then you can shift back just a little bit without falling. Make sure your feet are flat. Push the elbows out. And just breathe. And in general, we need to be in a stretch for 15 to 30 seconds to get that stretch reflex, right? Where everything is going to open up. And you might feel your tush fall. You might feel things. And you can just sort of sway back and forth if that feels good to you. But this is a perfect stretch for all of us to release our pelvic floors. So if we have pain with sex as a woman or even a man, or we're like an avid bike rider and we sit on that seat and it pushes on a perineum of a woman or a man, so long distance bike riding really gets a lot of tension. Also, my horseback riders have a lot of tension in their pelvic floor because they're constantly sort of in an activated state. The other thing I tell women to do is not to hover over the toilet. You should sit down all the way, unless you're sitting and peeing like this. Because if you're doing this, you cannot relax your pelvic floor and pee at the same time. It's sort of like a half effort. So, okay, we're relaxing here. Let's breathe in. And then exhale. We're going to do another one. And exhale. Let's do one more together. Exhale. All right, our last one is going to be, we're going to then lay down right here on our backs, if you would. Okay. Oh, that feels good. And your feet should be about hip distance apart, making sure that they're flat. And you want to make sure that your spine is neutral. I want you to put your hands on your belly just for a minute at the lower belly, and then we're going to change and I'll have you put your hand on your perineum. But for the first one, let's just breathe in and bring that belly button high. Really expand. It's a little bit harder in this position, right? Try not to elevate the pelvic floor, but rather feel the whole cylinder expanding. And then you exhale, tuck the pelvis, and bring the belly button to the spine. So you can feel the engagement of the pelvic floor just without even purposely doing it. Inhale, exaggerate it, and then exhale. All right, if you're not shy, left hand on the lower belly, and right hand, I want you to put it on your perineum. So just touch that area, just gently rest it. You can even put a tiny bit of pressure on the perineum with like the middle finger and the ring finger. Let's inhale. And then exhale. Do it again. And exhale. And one more. And exhale. Can you feel that a little bit? I feel like that's a nice way to do it, and that's a little bit easier for those of us who don't feel our pelvic floors that way. All right, let's come into a happy baby just to open up the hips. And then just take what feels nice for you, whether you're going to roll back and forth or you can bring those knees really in. And this is going to open up the pelvic floor again. Relaxing, and just take your easy breath here. Yeah, that feels so good. And then you're going to do knee chest, of course, and just roll little circles out. So again, morning practice. I'm getting up out of bed. I have a crooked back, or I have tight pelvic floor, weak pelvic floor. Knee to chest, little circles, happy baby, right? And then we roll up gently, together. And then we can always pop into a mula. Wait, I just had I had a spasm in my ab. Does everybody see I have a contraction? And then we could always come down to the floor and do a malasana squat. That was all that boat you did this morning. My abs in total roll spasm right now. All right. So in just a few minutes while we were flowing together, we improved circulation, we improved awareness, we improved connection to our pelvic floors. We allowed ourselves to be more connected to this foundation of not only our musculoskeletal system, our nervous system, as well as our foundation of our core. And hopefully that was helpful for you. Do you have any questions? That's it. That's all I have. So anybody wants to look at the pelvis, especially if you're a teacher and you've not really ever truly looked. So these are the inner muscles, and these are the main pelvic muscles. So if we look at it from an orientation standpoint, that's the coccyx. So there's coccygeus, and they talk about where they connect to. Ilio, coccygeus. Ilium, coccygeus, right? Pubo, coccygeus. Pubic bone, coccyx bone. Puborectalis swings around the rectum, connects to the pubic bone. So they all tell you exactly what they're doing. And then the sphincter muscles, the bulbar cavernosus muscles, transverse perineum, we all have the same muscles. And that's this muscle right here. Hopefully that was helpful, and if there's anything else I can do to share more information with you, let me know.
Thank you so much.
Thank you. Thank you.
I actually love to ask you.
Come,
It's nice to get out of the shade.
I know, please.
I know you mentioned
Oh, yeah.
weights, lifting weights.
Lifting weights, good question.
There's some women like Kim Omami that are big names that say how using jade eggs and weights are imperative.
Yeah, so here's an interesting thing. I'm one of these women because I have a back. I've been lifting weights since I was 15. And so I am so not a kettlebell swing between your legs person, because I think it's really detrimental to women's pelvic floors because most women are not strong there. If you are so connected with your body and you are able to maintain a proper pelvic floor connection while you're doing those kinds of weights, then I would say it's okay. I don't have an opinion about that, except that if you're highly motivated to put a jade egg in your vagina and you want to do that, go for it. I would say that it's a good way to get that sensory feedback so you know that you're connecting and contracting. Mm-hmm. Working out with that, I would say that there might be some fatigue that could happen, and we would have to be really careful, because if you fatigue the pelvic floor muscles, you also will have problems, pain, loss of urine, loss of bowel function, especially when you're older. As a younger person, we can stimulate our muscles a lot more in a shorter amount of time, and we will recover faster. But for example, when I put my 70 or 80-year-old patients on my magnetic chair to help with their urinary leakage, sometimes they get worse at first because their muscles are so fatigued just from stimulation. So specifically, is it bad or good for you? I would say in short amounts, in short bursts, it's probably very good for awareness. Could it help you get a little stronger? Probably. I would say most people are not motivated to do that. But in that highly motivated person, it's not going to hurt them as long as they're not walking around with an egg all day. Because then you're really asking for fatigue and for pain. Yeah. The other thing that I didn't mention, although now that you mentioned that, is a lot of influencers out there are telling women to lift really heavy, which I do agree with in a very controlled, isolated setting. I'm not a big fan, Rita knows, she works out with me, of, hack squats with a big bar on your back. Because I think that when you're in that, first of all, if your legs are apart, what's going to happen, right? So if I'm doing this, and I mean, we are not strong here, and we're pushing heavy, you're pushing out. And because I see pelvic organ prolapse all the time, it's not a good thing. If someone could have a finger in there and then do their exercise and see if they were actually doing it right, or pushing out, or having, a little muscle pressure probe.
We're gonna try that.
We'll try that next week.
But the point is, we tend to push out and we don't know it. We push out to, empty our bowels, let's say, but we really shouldn't be pushing hard. We should allow the function to happen naturally, and we get that little push at the end. So a lot of women push out when they're not aware of it, and that's when they'll get into problems. And so I'm just cautious about that.
So you're supposed to lift or contract when you're down in the squat?
Well, I would say that you would want to have a neutral pelvis, and if you can be aware of a slight contraction, just don't push out.
No.
But if you're doing these heavy squats and you haven't done anything to build your pelvic floor, you're still not doing your body any good. Because what happens is these muscles are so much stronger than these muscles that they're always going to take over first. So perhaps if we're going to do those kinds of workouts, we want to warm up our pelvic floor and pull some awareness. And even when you go to stretch, you can do a couple bridges, right? Like we didn't do bridges on our back, but you could do a couple of those activations just to be aware of it before you go into that. Having had, in this more personal share, having done thousands of surgeries and telling my patients don't lift anything more than 15 pounds for 12 weeks, which there's no scientific data to support that. Now my governing body is shortened it to 6 weeks. And in reality, we probably know that lifting per se doesn't necessarily cause pelvic floor prolapse. Constipation is a big one, so it's really pushing. So if you're pushing and lifting, that's the problem. Yeah.
Because I don't think I push up when I squat down.
You may not,
Yeah.
but you might.
Yeah.
Because most women are not really aware. We do think we are, but we're not. We tend to push a little bit more than we think. So I say don't go heavy.
Yeah, I don't go to.
I would say focus on all the form you can and really engage your legs and your quads. But it's going to be hard for you when you're thinking about a weight on your back and thinking about that to really lift up on your pelvic floor. So just don't push out, I guess is the best thing. And in reality, you can really work those muscles in so many other exercises that we don't, as women, I don't think we really need to be doing those things very heavy. Thanks so much.
Thank you.
If you have any questions, feel free to talk to me. And thanks for your attention.